Cancer Council acknowledges the traditional owners, both past and present, of the lands on which we live and work. Welcome to you all to tonight's webinar on sleep. How can we get a good night's sleep? My name is Lauren McLean, and with me tonight we have Anne-Marie, Kathy and Laura joining us. Welcome everyone. For any technical problems this evening, please put your question in the chat box and someone will be able to answer your question. Or you can phone through on 1800 733 416 and that number will also show in the chat box. For any sound problems, you can dial in and listen on your phone by calling the 1800 and entering the passcode also in the chat box. We encourage you to use the chat box this evening. We've got Laura moderating tonight and she'd love to hear from you, so please say hello. We will have time for some questions towards the end of the webinar, so if any questions pop up, please pop them in the chat box and we'll try and get to them if we have some time. If at any stage you need to speak to someone urgently this evening, please don't hesitate to contact a Lifeline counsellor on 13 11 14, available to speak to you 24/7. So let's get started. Firstly, I'd like to hand over to Anne-Marie, who's going to share a little bit about her personal story. Over to you, Anne-Marie.
Thank you. Good evening, everyone. In May 2015, one night I was woken by a phone call, and on my return to bed, the buttons on my pyjamas had popped open. Whilst laying down as I was buttoning up my top, I felt a large lump under my breast. I had been self-examining, but never right underneath. I knew immediately something was very wrong as it felt huge. It must be cancer, I thought, and of course I started to panic. A cold sweat came over me, and being midnight by now, I wondered how on earth I would be able to get back to sleep. However, somehow daybreak came and I managed to go through the motions of helping my two daughters to get off to uni and school. At 8:30 I rang New South Wales Breast Screen, who told me I wasn't due for a mammogram for another 4 months, so to make an appointment with my GP. Within 45 minutes or so, I'd found myself sitting with a locum who didn't say much after examining me and proceeded to organise an urgent mammogram. After being scanned and biopsied that afternoon, I forced them to tell me what they thought, as by now it was very late on a Friday and I knew that I wouldn't be able to cope over the impending weekend. They suggested that it was indeed suspicious. I was numb and completely shocked on how everything was happening so quickly, and it was only a week ago I thought I was healthy and life was great. On Monday evening I was beside myself with anxiety after spending the weekend not sleeping much. So I persuaded yet another doctor to tell me the results. He confirmed that it was indeed breast cancer and that I needed to see a surgeon. When I told my family and a few close friends, the shock of the diagnosis put me into autopilot. I remember spending hours shaking a lot and finding my legs were very heavy and it was hard to move. I'd never experienced these physical symptoms before and I dreaded night time as falling asleep was very difficult. Finally, the day to meet my breast surgeon arrived. She suggested a skin-sparing mastectomy with a saline expander to retain my breast shape. Then after treatment we could look into breast reconstruction, as she told me I would be needing chemotherapy. I really can't recall how much sleep I was managing to get at this stage, as the days seemed to go on forever and the nights even worse. Everything was a bit of a blur. However, I got through it, and a week or so later I found myself in hospital, pleased that the operation was over, but still struggling emotionally with what had happened to me. I felt relief with a mixture of strange excitement that the tumour was out of my body. I think I was so exhausted that I managed to fall asleep easily, probably due to pain medication. I had no idea what the next stage was going to be like. Once home, I tried to stay calm during the day with relaxation and meditation. However, I really was a bit of a mess, especially when the day came for the next appointment with my results. The tumour they'd removed was 4.5 centimetres and triple negative, meaning that it didn't have any of the 3 hormone receptors, estrogen, progesterone and HER2, which are all known to fuel breast cancer. It was fast growing and aggressive, and had started to grow into my chest wall and muscle. I thought I was lucky that I'd found it in the first place and it hadn't got any bigger. Treatment would be 4 months of chemotherapy, 25 rounds of radiotherapy, and then when I had recovered sufficiently, My choice was to have another mastectomy with DEP reconstruction. Put simply, this is taking fat tissue from the abdomen and transferring it to the chest to form new breasts. I estimated that I had 2 years ahead of me before this would be over, which seemed forever, and getting to sleep became a real challenge. It didn't help that there wasn't much information on the net at the time about triple-negative breast cancer, and when I did find it, it really scared me. I woke many times each night, which made me very sleepy during the day, often having naps and getting myself all worked up about not having to be able to get a good night's sleep. Of course, it became a vicious circle, and I couldn't seem to stop it. I was beside myself with having to have chemo. I never in my wildest dreams ever thought I would be in this position. I had no family history of cancer and was completely ignorant of cancer treatments. I found it really hard to get my head around what was about to happen to me. It felt like a really bad dream. The night before my first chemo was horrendous. I don't know how I managed to sleep at all. However, I got through the infusion and went home afterwards waiting for something to happen. It didn't. So I carried on with my day and tried as best as I could that night to get to sleep by using a new free app called Sleep Easy that I'd found on my phone. A few days later, the symptoms hit hard, and I spent the next 3 days in bed feeling like I'd been hit by a truck. I slept off and on during the following few days, and each night when I woke, sometimes after weird dreams, I would try and get back to sleep whilst listening to that app. I remember drinking lots of water to flush out all the drugs, but of course that meant visiting the toilet often during the night. In the daytime, I would just spend hours lying around, either in bed or doing my best impression of a couch potato, only managing the occasional walk with my dog on the good days. I might add that this was only a few months before the media came out with a suggestion that exercise during treatment would benefit cancer patients. I could hardly keep my eyes open when 5 p.m. came each day, so I'd eat an early dinner, as I was starving most of the time, go back to bed and lay there listening to the TV as I had no strength to even watch anything. Around this time, I contacted New South Wales Cancer Council, who put me in touch with a peer support person who'd been through the same diagnosis and treatment. She called me in the good weeks and knew exactly how I felt and helped put my mind at ease as we discussed my symptoms, and she recollected her thoughts and shared her tips to help me get through it. She was the first person I'd spoken with about how I was really feeling, and I began to realise that I would get through this, just like she had a few years before me. Her kindness and positive attitude made a real difference. The joys of chemo came with hot flushes and sometimes overwhelming feelings of distress and anxiety at night. That would also cause me to become overheated. I had just a few months before diagnosis installed a ceiling fan with a remote control temperature gauge in my bedroom that would turn on and off automatically. Now it was getting a lot of use. The sound also helped and was strangely soothing. As the weeks went by, I started to rely and became a little addicted to the woman's voice on my sleep app. I began to settle into a 3-weekly chemo routine and realised it was better to be a bit more active during the day, get out and about, and do stuff, anything that would help me stay awake to help me get to sleep each night. Halfway through chemo, I switched to a different drug and had to take steroids a few days before and after. I was so charged up with that it became even more of a challenge to get to sleep, let alone stay asleep. I was offered sleeping tablets, but after trying them once, I didn't like it, and so I just got on without it. I remember one particular night after the new chemo drug, I became so upset with chest pain, and after talking to my oncologist, he suggested a simple glass of milk to settle my stomach, and that really helped. Once I'd finished chemo, 3 weeks later, radiation began. It was now summer, and the heat and itchiness of the treated area made me wake often during the night, as lying in bed was quite uncomfortable, as I couldn't lay on my favourite side. It was suggested by a breast nurse to try a new wet chuck soaked in cold boiled water that I kept in the fridge. It was really useful in soothing the affected area. I started counting down the days until the end of treatment, and once finished, I got my energy levels back quite quickly. So we decided to mark this event with a family holiday, which was something that I really looked forward to. It was a welcome break as we went to the Barrier Reef, and the salt water felt so good and helped repair my damaged skin. The days were busy and I started to feel a little more relaxed and less traumatised, so I slept quite well in the air conditioning, I might add. This made me realise that life would be good again. It didn't feel normal yet, but surreal, but I was on the mend at least. 2016 arrived and I was all finished with treatment, but I still had 3 more surgeries to come. One day, whilst I was on the net, I found a website called Reclaim Your Curves that had a support network and closed Facebook group called About Breast Reconstruction in Australia. Once I was able to discuss my fears and ask questions about not only what I'd been through, but also what further surgeries would be like from women who'd had the same procedures, I felt I was becoming more confident with my decision, which helped me to sleep for longer periods of time without waking in a panic, as I sometimes had. I also concentrated on exercise and nutrition after taking part in the free Encore and Enrich programs. It really convinced me that I needed to get fit, and it became my goal each day to do at least 10,000 steps, plus interval and weight training. Something I'd never done before, as I was only doing 2 sessions of Pilates a week, walking my dog, and I thought that was enough. I might add that this was also with an exercise physio at the SAN in Sydney, which was the only breast cancer exercise group in my area and had been running for 10 years already, well ahead of its time, and I thank them for that. Also, I was given a personal program by the exercise physiologist that I'd met through the Cancer Enrich program. The classes I attended helped me get as fit and mentally prepared as I could before my next surgery, as for the first time I met other women face-to-face who'd survived cancer. They really inspired me. By tiring myself each day, my sleep patterns got better and better. Even though I was still going to bed quite early, I was still more stimulated mentally and physically and started to sleep without waking too much at night. By mid-2016, my D at breast reconstruction was approaching, so naturally my anxiety levels started to rise again. I found another app called Calm, which had sleep stories to help me drift off. Eventually, the night before my operation arrived, and I was admitted, and they convinced me to take a sleeping tablet. It was a great idea as I had a 12-hour surgery ahead of me and was naturally quite nervous. I, of course, slept like a baby. After a week in hospital and a successful result, I was back home, more in discomfort than pain. So I found my trusty fan and plenty of pillows helped me at night, along with a newly purchased bamboo mattress topper, which made my bed really comfy. It was great to be home and have that operation behind me. Naturally, I was relieved and excited that I was on the mend. Even though I had a few more minor surgeries to go, the big one was done, and well worth it, I might add. 6 weeks later, I was able to start exercise again, gradually rebuilding my strength. I became stronger, skinnier and fitter than I'd been in decades. This really made me make the most of each day and be relaxed each evening, not dreading bedtime anymore. It's now more than 3 years since that life-changing day. I found these mottos really helpful that I used to go for long walks on during times like the night before an appointment or scan. Some were said to me by doctors and others I've just picked up along the way. For me, exercise, eating well, mindfulness and no alcohol since diagnosis have made me sleep well most nights, providing I keep my skim flat white and almond dark chocolate addiction under control, as they aren't the best choices for getting to sleep. I hope everyone listening to me this evening who's going through treatment or surgery soon, or maybe you've just been diagnosed, I hope you get a little comfort in the fact that if you have trouble sleeping one night, hopefully you'll be tired enough to sleep better the following. Thank you.
Thank you. Thank you so much for sharing your story, Anne-Marie. It's not easy and such an honest, story that you just shared with everyone there. And I know from a lot of the questions we received when people registered for the webinar, a lot of what you've just touched on then has certainly addressed or at least made others in the audience be able to relate to your story. And I think people find comfort in knowing that other people are experiencing it and they get it, and you will get through this as well, well into your survivorship phase. So thank you so much.
You're very welcome.
We're going to pass over to Kathy now, and Kathy and Laura are going to do a bit of a tag team. Dr. Laura Kirsten is a psychologist, and we've got Dr. Catherine Mason joining us, and she is a psychiatrist. So thank you.
Thank you very much for asking us to be here. And it was a terrific description.
Oh, thank you.
The ups and downs of sleep for the people on the cancer journey. And there's not one problem or one solution. I think you illustrated that beautifully. So we've got just a few slides with an overview of the science around sleep, I suppose you'd say. And one of the famous sleep researchers described sleep as something that's of the brain, for the brain, and by the brain. And although it is of the brain, for the brain, and by the brain, it affects all the rest of your body as well. It's pretty much universal for animals, so even whales and dolphins sleep, and it seems to have an important function in restoring and repairing our bodies at a cellular level that we don't really understand very well at this stage. It's also very important to maintain a number of psychological functions, and there's research to show that sleep improves or helps you maintain good attention, concentration, memory, good reaction times, and even your sense of humour.
Important one.
I'd like to know how they did that research. And sleep is divided up into a number of different stages, and most of us cycle through those various stages during the 6 or 8 or maybe 4 hours that we're sleeping. And you transition from wakefulness into non-REM sleep, that's non-rapid eye movement sleep, which has 4 stages, 1, 2, 3 and 4. And you spend time in and out of rapid eye movement sleep, which is essentially your dreaming sleep. These stages are described by EEGs, or electrical traces of the brain's electrical activity, and that's a kind of a summary of the different waves that are picked up electrically in the different stages of sleep, and that graph there shows how a healthy young person in their 20s cycles through those stages, but that pattern would look very different for an infant or for a toddler or for a school-age child or for someone in their 60s or someone in their 80s. So the way in which the pattern that we follow going in and out of these various stages of sleep changes as we develop over time, and we don't stop those changes until late old age. A little bit more detail about those stages. Stage 1 is when you're in that sort of drowsy, relaxed state. Your breathing slows down and your muscles relax and your heart rate drops. And you're sometimes a little bit aware of falling into that. You're just drifting off to sleep in that stage. In stage 2, it's a slightly deeper stage, but it's still quite a light sleep. Your body temperature starts to drop, your breathing and your heart rate become regular and slow. And then in stage 3 and 4, you're in deep sleep, and this is where you get most of that sense of restorative sleep, and this is the sort of sleep that leaves you feeling refreshed when you wake up. There's the lowest amount of physical activity during that stage of sleep. Your blood pressure drops, your breathing slows, your muscles relax and receive more blood supply. This is when tissue growth and repair occurs and where hormones are released. And finally, there's rapid eye movement or dreaming sleep, which is about 25% of sleep time. And that's a period where your brain's pretty active, but your body not so much. And it seems to be important in your being able to translate information that you've collected during the day into long-term memory. So we don't really understand all of the things that dreaming sleep does for us, but certainly in allowing us to make memories from that day's activities. And then it seems to be it's when we link up those memories to other bits of information that we've got in memory stores so that we can retrieve them again. So how do researchers go about looking at sleep quality? We talk about a number of different things when we're trying to work out whether someone's having good sleep or not so good sleep. What's called sleep latency, which is how long it takes you to fall asleep after you've turned out the lights. Sleep efficiency, which is the ratio of the time spent asleep to the time spent in bed. So if you're in bed for 8 hours but you're only asleep for 5, that's not very efficient. The sleep time, so how many minutes or hours you're actually asleep. And then the sleep quality, which is a very subjective measure, but obviously very important. There are a number of different disorders of sleep in adults. I'm not going to go into the disorders of sleep in children. And I put insomnia in bold because far and away it is the commonest problem with sleep for adults. And it is really very common. And it's certainly the commonest sleep problem for adults with cancer. There are also sleep-related breathing disorders, and sleep apnea would be the most well-known of those, where people stop breathing when they drift off to sleep, and then their body wakes them up again, and then they half wake up and then fall back asleep and then stop breathing again. There are conditions of hypersomnia or excessive sleepiness that are of central origins. That's essentially a neurological condition. What we call circadian disorders, and the most common of those, the one most relatable, I think, would be jet lag. Anyone who's travelled time zones would know what that feels like. That's a classic circadian disorder. But we can create a similar effect when we disrupt our sleep-wake cycles. Then there are the parasomnias, which include a range of conditions like sleep, night terrors, and then there are sleep-related movement disorders, which are things like REM, sleep disorder, restless legs, what doctors call bruxism, which is kind of tooth clenching during sleep, which can give you quite bad headaches on waking and can cause your dentist to get very rich. And then, of course, there's another category for all those things that are rarer and don't fit in. So we're going to concentrate tonight on insomnia. Laura and I will really be talking about insomnia and treatments for insomnia. So insomnia is essentially difficulty falling asleep, difficulty staying asleep, and dissatisfaction with the quality of your sleep. And as you can see, the figures are up there. It's very common, up to 40% of the general adult population. If you ask them, have you had any times in the last month when you had difficulty falling asleep, difficulty staying asleep, 40% of people will say yes, 50% of cancer patients, and even higher rates in patients in palliative care. It can be transient, lasting for just a few days, a couple of weeks, or it can become chronic and a source of great misery when people have months or years of not being able to sleep well. There are some things that cancer patients experience that are particularly likely to contribute to insomnia. So quite often symptoms that you're trying to deal with get worse overnight. So pain might be worse overnight. Coughing might get worse when you lay down and there's a little bit more congestion. Breathlessness similarly might get worse when you lay down. And that's going to make it really hard to go to sleep and to stay asleep. You tend to find that when you retire to bed, turn off the lights, even though you were feeling really sleepy when you got into bed, that's when screensaver comes up and all of those thoughts that you have been managing to avoid or not engage with during the day because you're keeping busy, you're doing this, you're doing that, you're watching something good on TV or you had a great phone call with your friend and you go to bed and they all are, they flood up. And once they get a grip, it can be very hard to shake them, but Laura's going to talk in a little bit more detail about some of the techniques and strategies that can be useful there. It's very easy to fall asleep in the daytime if you've tired from your treatment and you're now into the 5th or 6th or 7th month of treatment. And that period of time, just in the early afternoon, but around about 1, 2 p.m., that's when physiologically we're most likely to nap off, fall asleep, and it can be really difficult to resist it. But if you fall asleep then and sleep for an hour or two, that's going to then make it harder to sleep through the night that night.
I love a good nap.
Which is fine if you're sleeping through the night, but it's not so good if you're napping in the day and sleeping through the night. We're often told to drink more water when you're having chemotherapy, and that means that you're going to be passing more urine, so you're going to have a full bladder, which will wake you up, and then when you get back to bed, the screensaver's there and you can't get back to sleep again. Or sometimes the treatment that you're receiving actually irritates the organs in the pelvis, so you might be having radiotherapy to that area, for example, and again, you're going to find that you get up more at night to pass urine. We certainly some of the medications that are used as part of your cancer treatment will interfere with sleep. And corticosteroids are the classic example. So sometimes they're used to help to modify side effects of treatment. So you might take some steroids to reduce your risk of nausea and vomiting with chemotherapy, but then you can't sleep because the steroids disrupt your sleep. Or if you've got a hematology cancer, a blood cancer, corticosteroids are usually a core component of treatment for those cancers, and so you really do have to have often quite large doses and you will inevitably get some disruption to sleep. And then there are a number of psychological disorders that you're more likely to get during your cancer experience that themselves will disrupt sleep, and delirium is the one no one ever talks about, but lots of people who've been in hospital and had major surgery have a period of delirium in hospital. And delirium is about disrupting your circadian rhythms partly. And so, of course, your sleep is often quite reversed. And if that hasn't resolved by the time you get home, it's going to continue to be a problem at home. And then, of course, depression and anxiety, which we can go into more detail about. So I'm going to hand over to Laura.
Thank you. Great, thank you. So I'm going to talk a bit about some of the therapies we do for insomnia. But before we do that, we need to think about what's happening for the individual person with their insomnia. And so really, when you come and see a psychologist or psychiatrist, they will do a thorough assessment looking at the insomnia and trying to determine where the issues are with your insomnia. So I've got the model of insomnia up, and this is called the 3P model. And it lists some of the factors that influence insomnia. And so there are some predisposing factors, so some factors that make a person vulnerable to developing insomnia, such as being an older age, such as being female. But then there's the precipitating factors. So these might be the factors that happen just prior to the insomnia onset. So this might be stress from a cancer diagnosis or treatment. It could be a psychological disorder. It could be side effects of your cancer treatment that might be a precipitating factor for the development of insomnia. And then there's the perpetuating factors, and these are the factors that really maintain the insomnia. So here we're looking at things like the daytime naps, which Dr. Mason was talking about, excessive time in bed, sleep interfering activities such as watching TV in bed or on your iPhone or iPad in the middle of the night. And then there's also unrealistic sleep expectations. So there's a lot of media about we should all get 8 hours sleep a night. And so that can make people feel quite anxious if they're not achieving that. So what can we do to improve our sleep? So this is just a very brief review of the evidence around what works for sleep. And I guess the intervention that a person gets depends on the nature of the sleep disturbance. But broadly speaking, in insomnia, the primary research suggests that the best treatment is cognitive behaviour therapy for insomnia. And this is found to not only help with reducing the impact of the insomnia on a person, but also has long-term benefits as well. And so it helps to maintain sleep patterns. Other interventions that are being investigated include internet-delivered CBT for insomnia, and that's been found to be quite effective. And other modalities that they're looking at or interventions that people are considering are things like light therapy, exercise, mindfulness, yoga, and acupuncture. So I've attempted to draw up here what I'd normally draw up in a clinic room for one of my patients, and essentially it's on the left-hand side we've got a 24-hour clock. The top half of the clock is essentially nighttime, the bottom half of the clock is daytime. And what can happen for people is that they can feel really, really tired and can't keep their eyes open, so go to bed about earlier than usual, 9:30, and then might have a few hours sleep and then they're up and that's it for the night. And then they might feel like they need to try and get back to sleep, so they will try and rest in bed from, say, 5, 6 onwards for a few hours and still maybe not be so efficient with their sleep. And so we're talking about sleep efficiency, so maybe laying awake for a good deal of that time. And then so tired, trying to catch up on that sleep. So later on in the afternoon, they have a cat nap. So you can see that the time of sleep is all over the shop, and so they're not getting a good solid sleep. So with therapy, what we try to do is try and consolidate that sleep from being all over the 24-hour clock into being in one block of time. So I think, though, what's important to remember, like this, I've just drawn an 8-hour time frame, but 8 hours is not necessarily the goal that everyone should be aiming for. I think it's about setting up realistic expectations at the beginning of your sleep intervention, and it might be that your first goal is to just get 4 hours of solid sleep, and then gradually building up on that over time as you work with your therapist or work through some guidelines around managing sleep. So here are some tips for better sleep that we found and that research has found works, and these are the basics of the cognitive behavioural therapy for insomnia. So the first thing is about comfort. So it's really important to try and make sure that you have a really comfortable sleeping area. So you're not going to get too hot overnight. Your pet's not going to jump on you and growl every time you move. Had that happen.
I didn't mention that bit.
That the light's not going to flash in your eyes in the middle of the night or first thing in the morning, and that you're comfy. So Anne-Marie was talking about having the bamboo sleep cover, which helped with your sleep. So just thinking about, how comfortable you are when you're sleeping. Also partners or bedfellows can be a bit of a problem. So if you've got someone who's like a hot water bottle next to you and you're struggling with heat, then that might not be ideal. Might need to look at the space between you when you go to bed. And snoring, of course, if your partner's keeping you up with their snoring, that's not great either. There are other things that are related to the cancer and cancer treatments, such as pain, nausea, bowel problems, and having to get up to go to the toilet a lot, or hunger. So I guess in managing some of that, it's about just having some practical ideas or some education about how best to manage it. So just as a practical example, we might say to someone, if you're getting up frequently to go to the toilet, or 2 o'clock in the morning, every morning you're getting up to go to the toilet, then try and have your last drink earlier in the night, so that hopefully you can go to the toilet before you go to bed, and that will be hopefully preventing that. Now, the next tip is around the circadian rhythm, so trying to restore that. So these are instructions around how to maintain that. And the first thing is to get up at the same time each day. And when I talk to people about this, I'm really unpopular. It really works. And and you can see why I become unpopular later on when we talk about some of the other strategies. But get up at the same time every day, so at 7, 7:30, whatever. Even if you've not slept all night, you need to sort of get up at the same time. Try to go to bed when you feel sleepy, so you catch a wave of sleepiness, like your eyes are going to, close. So try to go to bed at that time, so you are feeling sleepy. Don't go to bed because it's 10:30 and that's what time I always go to bed, or I've always gone to bed in my life. If you're falling asleep on the couch, then you've probably missed your wave of sleepiness, so you need to try and get to bed before that happens. Avoid the cat naps in the day because they are really going to disrupt the sleep cycles. And have a wind down time before bed. So that might be, for a lot of people who are parents out there, they might know about the bedtime routine. So bath, book, bed. So you might do a similar sort of thing. You might have a nice warm bath or shower. Have some relaxing music or do a relaxation exercise, and then go to bed.
Just on that, Laura, we asked a question in the chat box, if lots of people do nap during the day, and there was lots of yeses that came through.
Yes.
So, if you're feeling so sleepy and tired because you haven't had that good night's sleep, what do you do when you get to that point at 2 o'clock in the afternoon? All you're dying for is a nap. What's the strategy?
Again, I get unpopular. I usually suggest go for a walk.
Mm-hmm. Yeah.
Just something, because it's what we're trying to do is establish a strong link between bed and sleep, and sleeping at an appropriate time.
Mm.
If you're sleeping all right at night and you're napping in the day, that's okay, because sometimes during your treatment you actually do need that extra catch-up, and that's not a problem if you're doing that, having a half hour or an hour nap in the afternoon and then still sleeping okay at night. It's only when you're not sleeping at night and you're awake from 4 a.m., then it's a problem and you need to do something about it.
Sure.
So you can have something to do that's a little bit stimulating or a little bit interesting. So you might call a friend at 1 o'clock, 2 o'clock in the afternoon. You might go for a walk. You might make sure that's the time when you're going to go down to the shopping centre. Or sometimes I say to people, if you are just having to fall asleep, put a timer on the phone, so that you have an alarm and you won't end up napping for 3 hours and then not sleeping at all that night, but you'll nap for 40 minutes or 45 minutes. Yeah.
Okay, great. Sorry to interrupt.
So I guess, with all of these suggestions, it is really about that time when you are having problems with your sleep. So if there's no problems with your sleep, then just be wary that you can develop some bad habits with catnapping. All right. So the next tip is around lifestyle. So I guess there's some things in lifestyle, and we've already covered some of that tonight, but some of the things that have been found to be effective are exercise, which improves sleep architecture, sleep latency, and helps with daytime fatigue. But alcohol doesn't really, so try and avoid alcohol, recreational drugs, and of course caffeine's not your friend if you're having problems with sleep, so try and limit the amount of caffeine you're consuming after about 12 o'clock noon. And also look at your nutrition, try and make sure your nutrition's good. And it might be that you're experiencing reflux, and that is a bit hard to get to sleep at night. So what we'd suggest you do is either look at what you're eating that might be contributing to the reflux, or looking at how you manage your meal times. So I've put in here some tips about foods that can assist with sleep. And so there's a range of foods that I've listed here, and these might include like turkey, dairy, so it might be your warm glass of milk with Horlicks or with honey, bananas, and all of these foods help to trigger the sleep. A lot of them have what's called tryptophan, which helps with converting to melatonin, which helps with getting to sleep. So the foods that contain calcium, potassium, magnesium, tryptophan, and B6 can all help improve sleep. Now I'm going to talk about habits, and this is the tricky thing, and this is when I become really unpopular, especially in winter, because essentially, and I think even though this isn't popular, it I think really is the thing that impacts most on quality of sleep for people, and that is about trying to establish a really strong link between bed and sleep. And the way we do this, it's called a stimulus control intervention. So what we're trying to do is, if you're not falling asleep within 20 to 30 minutes of going to bed, get up. Get out of bed. If it's winter, have a warm gown or blanket to wrap around yourself, and then do something that's not stimulating to the brain, and then just go back to bed when you feel that next wave of sleepiness. Now, once that next wave of sleepiness comes, go back to bed, and if again you're not asleep within 20 to 30 minutes, again, get up and repeat. And this can go on until your wake-up time, whatever time that is in the morning. And I guess the thing with this is I just advise people not to be clock watching. So if you've got a bright clock next to you, turn it away so you're not going, oh, well, it's, 27 minutes and I still haven't fallen asleep, because that, of course, can stimulate the mind and make it harder to get to sleep. Now, I've also mentioned about not worrying in bed, and especially about not sleeping, and this can be really tricky to do. For some people, I recommend having a little notepad which you write your worries on, if they're keeping you up at night, so you can worry about them the next day. But sometimes there's some worries or some thoughts that just go through the mind that it might be worth talking to a therapist about, to try and work through some of that. And the thing about worrying about sleeping is, with worry, with thinking, it stimulates the brain. And the thing we know is that if you don't get enough sleep, you're probably just going to be a bit tired. So the next tip is about relaxing. So relaxations can really help. So some strategies that can be used include progressive muscle relaxation, guided imagery, meditation, mindfulness, and breathing techniques. So there's a range of free apps available on your phone, and the Cancer Council has got a couple of CDs available which might be helpful. So this one is the relaxation CD, and I think it's track 5 on this CD, has a sleep track which is about 20 to 22 minutes. You can download it from the website, or I give it quite often to people I'm seeing, and just ask them to upload it onto their phone or play it on their DVD or CD player, and that can help with giving you a relaxation exercise to help manage the sleep.
And since lots of us don't have DVD
Yes.
players, it's worthwhile mentioning you can live stream it from the website.
Yes.
So if you've got your phone, you just use your internet, go online, live stream it.
Yep.
And very easy to do. Yeah.
Yes. So they're my main tips for getting a good night's sleep. Generally, I find that the more closely you follow the tips, the better your success is. And I think that what I've generally found is that after about 3 weeks, we see an improvement in sleep quality for people. So whether that's just getting to that first stage that people might be aiming for of getting 4 hours of solid sleep, and then we try and work up from there.
Thank you.
So, yes, I'm going to do the next one too.
One more slide.
One more slide. So this one's about, this is just about treatment for insomnia. So the cognitive behaviour therapy for insomnia, which I've just gone through most of that, learning to working on your relaxation techniques. So relaxation is actually a skill. So the more you practice it, the better you get at it and the more benefit you get from it. You might need specific psychological therapy for helping managing the worry that we spoke about. And learning meditation is a great strategy. And there might be some specific strategies for recurring nightmares that you can usually see a therapist for to help talk through that. And that might involve things like coming up with a new ending for your nightmare or whatever, or just managing the distress around nightmares.
Well, I've got you, Laura. Our questions come through around with forming that habit. So if you go to bed and you're not asleep with that 20 to 30 minutes, get up. Just a question around, is reading a good thing to do when you get out of bed?
It depends on how good the book is.
Oh.
I find that sometimes if I read, I'll just read another chapter or something like that. So I think you've got to think about how stimulating the book is for you. And if it's too stimulating, as I said, these interventions should usually only last for a few weeks or a few sessions, so it's not forever that you need to follow this guideline, but just until we see an improvement in sleep. So I would generally say if it's a boring book, yeah, go for it, but if it's a good book, probably I would avoid that.
All right.
Yeah.
Well, sometimes you can go to the local library and get some picture books. Okay. So there's, lovely scenes to look at, but not too much intellectual content. You don't have to follow a story. You're not kind of keeping track of the secret identity of the key character or whatever. And you can get them for free from the local library and have a range of them. If you love gardens, you'd have some beautiful gardens. If you love travel, you might have some places you're going to go on your holiday when you've finished your cancer treatment.
Yeah.
And the other thing you can look at is talking books, or spoken books, audio books.
Okay.
And again, most local libraries now have an app that you can put on your phone and you can download them from the library because they're quite expensive to buy, in the iTunes store or whatever. And if someone's reading to you, especially if it's a fairly non-exciting kind of book, or your favourite book, you loved Harry Potter 20 years ago when it was first out and you still love it, and so you've got Stephen Fry reading Harry Potter to you and you'll drift off to sleep.
Actually, one of the sleep apps I had, Calm, has a lot of sleep stories. Some of them are free and Stephen Fry's one of them.
Yes.
And some of them are like really boring things, then it tends to make you drift off quite well. Yeah.
So something like counting sheep or
All
right. Thank you.
Thank you.
So I've got the last couple of slides. We're going to talk a little bit about medication for insomnia, and I'm going to say straight up that there are a lot of limitations around medication for insomnia. You're much better with meditation than medication because we really don't have anything that has been demonstrated to really improve sleep quality and really improve your time in those restorative stage 3 and 4 levels of sleep. It does increase your time in stage 1 and 2, so you have been asleep for many hours, but you haven't necessarily had the refreshing restorative sleep. And if you're not very well, if medically you're not very well or you're older, it can increase your risk of developing delirium, including when you go into hospital and have even more reasons to not be very well. So lots of things that you get over the counter and complementary and alternative medicines that are recommended as treatments for insomnia. it's worth trying some of those. Most of them are usually don't have a lot of side effects. But if you're going to take anything like that, please tell your treating team because they need to know. And there is a big variation in the quality of some of the things that are sold as complementary and alternative medicine. So some of them are very good and very accurate in the labelling. Some of them are not so good and not so accurate in the labelling. So please tell your team. Melatonin is a protein that your brain produces and is part of your normal circadian rhythm, and so you usually produce melatonin in the early hours of the morning, and it's part of what helps to keep your sleep cycle healthy. It's now available as a medication. It's available in a controlled release form on prescription for people over 55 in Australia, but you can buy it as what's called a private script and get a compounding pharmacy to make it up for you. And some people buy it over the internet from the US where it's available with much less restriction than we have here. I would not recommend doing that because, again, we can't guarantee the quality of the product that you're consuming. It's probably worth a try. If you have that shift, that circadian rhythm disruption, and if something like corticosteroids or hospitalisation and delirium have been the trigger for your difficulty sleeping, it's definitely worth a try. There's lots more evidence arriving every day about how useful it is. I would have one kind of concern, and that is that we don't have very much information at all about what's the consequences of taking it longer term. So you can get a script for about a month's supply in Australia, and most of the research studies follow people for weeks. But if you take it for a year, we don't know what that does, so that it's still an area of evolving research. The commonest sleep medications that are prescribed in Australia are benzodiazepines. So they're things like temazepam and Mogadon. Remember your grandmother being on Mogadon? And they are basically anti-anxiety medications. So that if the thing that's stopping you from sleeping is that screensaver and those worries that are flooding into your mind when you put your head on the pillow, they work quite well because they help to tone that down. Unfortunately, you can get used to them very quickly, and some people do that more rapidly than others. And so then you reach a point where you need to increase the dose, and then you get used to that dose, and then you reach a point where you need to increase the dose again, and then you get used to that dose. So you can end up, unfortunately, in this stepwise sort of escalation. And if you've been taking them for a while, so that's weeks to months, it can be very difficult to stop, and you can sometimes need assistance in, a planned tapering because stopping is actually very uncomfortable physically. So they're good for short-term use. So they're terrific for taking the night before your first chemotherapy or the night before that scan, that review scan that you're really a bit anxious about, and so you might take a temazepam that night. But if you're using temazepam every night for weeks, it's not going to be very good at all. There are some sedating antidepressants that are sometimes used to promote sleep, and the commonest of those would be mirtazapine and the tricyclic antidepressants, which have been around for a long time, since about 1961, and are often used in low doses. They can sometimes help if an irritated bladder is causing you to get up a lot at night too, because they tend to help with the urinary frequency as well. There are a category called Z drugs who have a mechanism of action very similar to the benzodiazepines. One of those is on the pharmaceutical benefit scheme and one of them isn't, and I don't understand the rationale behind that. Again, they're really only approved for short-term use, so up to 5 nights in a row. Some people end up using them for weeks to months, and we don't have good information about how safe that is. And very occasionally people have a bad reaction to them and do all sorts of strange things, get out of bed and sleepwalk and wander around without being conscious of what they're doing. So that's a relatively rare complication, but certainly one that can be quite concerning. And finally, low-dose antipsychotic medications. So these are what we would call major tranquilizers, and they're usually approved for use through the pharmaceutical benefit scheme for people with psychotic illness. And some of them are approved for use in lower dose for anxiety disorders. And for insomnia, they're usually used in tiny doses, but they can be very helpful in that you don't develop the tolerance and the dependence that you do with the benzodiazepines. So sometimes they're actually a very good solution. I would say, though, that if you're looking to use medications for helping with sleep, really important to combine them with the good sleep habits that Laura was talking about. So don't just think medication or sleeping tablets are going to be all you need to do. They're going to be much more effective if you combine them with good sleep habits. Consider maybe using a sleep diary to keep a bit of a track of how much you're sleeping, and think about those things like sleep latency, the sleep efficiency, the satisfaction with sleep. Set some realistic goals, and I know Laura talked about that too. And just review it after 4 to 6 weeks, see how you're travelling. Or even less, with melatonin you should be starting to see an impact within about 3 weeks. So don't just think this is the solution, that's all I need to do. Come back and review it, see how it's working. I would echo what you said, though. I personally think that exercise is probably the single most useful, effective intervention that you can do to improve the quality and, the success of your sleep. Yeah.
Thank you.
I hope we've left some time for questions.
Yes, if you pass that mouse back to me, we can go on to the questions. Okay. There were some questions coming up there when you were talking about medications, though, particularly around hormonal therapies, I think, and the timing of the day in which those medications are taken and how that can perhaps, affect their sleep at night with regards to maybe the hot flush effects and things. If switching the time in which you take those medications, will that perhaps have some improvement?
Look, some people find that works and some people find it doesn't. With the corticosteroids, it's often a recommendation to take them before midday if you can, but if you're using them to try and modify the nausea and the vomiting, you might need them later in the afternoon to be able to have something to eat later in the afternoon. So it's sometimes you just have to do a bit of trial and error and work around for yourself. With the hot flushes that are due to the estrogen blockade, we've got that operating all the time. And so while it might be that, within the first few hours of taking a medication it's worse, most people find that it's cycling in and out the 24 hours of the day. We might notice it more at night because there's less you can do about it and you're lying there with the doona and the dog. I'd certainly trial and error, fiddle around with it, see what works for you. That's totally worthwhile trying.
Okay, great. Well, we do have a bit of time for questions, and there's been heaps of great questions. I think we've answered a few of them already. I think the first one with regards to how do ongoing pharmaceuticals impact sleep, you did just touch on that a little bit. I don't know if there's anything you wanted to expand on, maybe.
Look, I'd also say that if you're finding that it's really a source of frustration and distress and making your life miserable, do talk to your oncologist about it, because often they will either try a different preparation from the same family of medications, or they will sometimes suggest very small amounts of, for instance, estrogen, to see if that helps a bit. So your oncologist doesn't want you to suffer. They want you to have a good quality of life. And if it is causing those sort of problems, please go back to your treating team, talk to them. Sometimes some fine-tuning can actually make it tolerable. Won't necessarily make it go away, but it can make it bearable.
Okay. I think we've addressed the hot flushes and the sort of cold sweats already, but we might skip down to question 3 in the interest of time. And this question is, I wake frequently during the night. How do I fall back to sleep, or how do I avoid that waking up in the first instance? So I think Laura had some great practical strategies around that. I don't know if you wanted to reiterate anything with regards to that.
Yeah, look, I think the question is, why are you waking up? And so it'll be a matter of looking into that and seeing if it was any of those factors that we were talking about before that was affecting your ability to stay asleep. But I guess the overarching sort of intervention that I would probably look at using is that stimulus control, so trying to establish a good relationship or a good response that the bed is for sleep, and so making a stronger association between bed and sleep. And so that is that going to bed only when you're sleepy, and then getting out of bed if you're not falling asleep, and then waiting 20 to 30 minutes and then getting out of bed again if, again, you're not asleep. So going back to that tip, which was called habits. Right. Yep.
And this next one, so besides a lot of these sleep hygiene strategies which haven't been successful for this particular person, is the next step for them to then look at some medications if those strategies aren't, useful in the first instance? Is that...
Yeah, and look, and if it isn't that there's pain that could be better managed or, there's nutritional aspects that could be better managed. So, go through all of that, think holistically. The sleep hygiene habit, the good habits around sleep, you really have to persevere with them for at least 3 weeks, and we'd say actually 6 before you abandon them, because we kind of develop habits around sleep quite quickly, and you then need to put some work into changing and developing the next new habit. And if you've got small children, you know what it's like when you've been waking up to do a feed in the middle of the night and then the baby starts sleeping through, but you're still waking up to do the feed, and it takes a while for mum's habits to catch up with baby's habits. And similarly with teenagers.
Yeah, we were talking about that, yeah.
If you're staying awake in stage 1 sleep, waiting for them to come in the door at 2 o'clock in the morning, and it takes a while once they've settled down and they're no longer out burning the candle at both ends. So do persevere with the sleep hygiene for, at least a period of 6 weeks. Sometimes people do the sleep hygiene in combination with the medication, so it's not like it's one or the other, it's usually both together. And I think some of those more specific suggestions with the stories for sleep, the apps, sometimes things like, you can get some with soothing sounds, it might be bird calls or rainforest sounds.
And people were saying white noise in the chat box as well. They're finding that quite useful.
White noise, I would recommend against the trickling stream.
Choose this.
You mean what we've already discussed? Some of the other white noise apps are quite useful, and so trying some of those things as well is probably worthwhile doing.
Great.
And really going to emphasise the exercise.
Yeah. I think we touched on the melatonin, and certainly the exercise sounds like it worked for Anne-Marie, and Kathy and Laura both echoing that, so that sounds like a great strategy. There was a question in the chat box earlier with regards from Bridget. She was asking, is it a bad thing to go to bed really late? So she finds herself getting tired at 1 or 2 a.m. in the morning, and so she's staying awake until then when she's feeling sleepy. Is that a good thing or a bad thing? Should she be trying to get to bed a bit earlier, or if that's when she's feeling sleepy, is that okay?
Sometimes these habits can develop. I know that a lot of mums that I know tend to go, wait for the family to go to bed, and that's when they get their quiet time and their time out, and that's quite sacred. So it's about tossing up and trying to work out how much sleep do I need to function, and if you're going to bed at 1 o'clock in the morning and you're sleeping fine until 7 o'clock in 6 hours is enough for you to get by, then that's fine. But if it's not, then you probably do need to look at trying for an earlier sleep time. But that would mean getting up earlier in the morning.
One of the difficulties with retiring to bed later is that you sometimes got a block of time where you don't have much opportunity to interact with other people. So if most of your friends or your family go to bed at 10 o'clock at night and you're staying awake with not much to do or not much to think about till 1 a.m., that's often going to be the time when you do your worry. And so that's not such a great idea. But if you're putting the family to bed and then, doing your knitting or doing some drawing or painting or
Netflix,
reading some, and that's satisfying and fulfilling, and that's a nice time for you. Well, that's fine.
Okay. Yeah. We are running short of time. There's been lots of great questions. One really quick one though: is it better if you are going to nap during the day in bed or on the couch?
I'd probably. Well, I guess it's about how comfortable your couch is for a start. We don't want to wake up with a back injury.
Or to make your pain worse because falling asleep in a chair, which isn't really designed for that. Yeah, I'd probably say in bed. And if you're going to nap, then decide you're going to nap and go to bed.
Timer.
Yeah.
Take that
Again,
time out.
the cat naps themselves aren't a problem unless you have problems with sleep at night.
Yeah.
Yeah. And I mean, I think sleep problems are a real significant problem for a lot of people. They don't tend to get identified well. So a lot of people just sort of suffer along. But if you can follow some of these strategies, hopefully that will help.
Great. Well, thank you so much. That is all that we really have time for tonight. But just a reminder that the webinar is recorded, so everyone who's registered, you have the opportunity. We'll email out the link to watch the recording at a later date if there's anything you missed. We'll also send out a list of all the supporting resources that have been mentioned this evening, as well as some others that are offered through the Cancer Council, such as our Sleep and Cancer podcast that's available, and all the other great ideas that have been suggested tonight. So we'll email that out to you. I was going to just thank the panel, of course, for all of their time and volunteering their time to put this presentation together. I think some really great practical strategies have come out of it, and I hope it helps you all to get a really good night's sleep tonight.
Or in 6 weeks' time.
That's right. And just a reminder, please, if you could take 5 minutes to complete the exit survey on your way out, we'd very much appreciate your feedback, and look forward to seeing you on the next webinar. Good night.